Here are 10 questions based on nutrition to help you pass your nursing fundamentals exam. Question 1. A nurse is caring for a client diagnosed with dysphagia. Which intervention should the nurse implement to ensure safe oral intake? Provide thin liquids with a straw, encourage large bites of food, offer foods with varying textures, serve foods at extreme temperatures. Pause the video and select your answer. If you chose option C, you are correct. Offer foods with varying textures. Clients with dysphagia often have difficulty swallowing certain textures. Offering foods with varying textures helps ensure safe oral intake by reducing the risk of aspiration. Question 2. A client with heart failure is prescribed a low sodium diet. Which food item should the nurse recommend as the best choice for this client? Canned soup, fresh vegetables, potato chips, processed cheese. Pause the video and select your answer. If you chose option B, you are correct. Fresh vegetables. Fresh vegetables are low in sodium and are a suitable choice for clients on a low sodium diet, such as those with heart failure. Question 3. A client with diabetes mellitus asked the nurse for guidance on meal planning. Which statement by the nurse is most appropriate? You should avoid carbohydrates altogether. Include a variety of fruits in your diet. Consume high fat foods to control your blood sugar. Limit your intake of simple sugars and sweets. Pause the video and select your answer. If you chose option D, you are correct. Limit your intake of simple sugars and sweets. For clients with diabetes mellitus, limiting the intake of simple sugars and sweets helps in managing blood sugar levels and preventing spikes in glucose. Question 4. A nurse is assessing a client's nutritional status. Which finding indicates a potential need for further evaluation? BMI of 22, albumin level of 4, hemoglobin A1C of 5.5%, serum potassium level of 3.8. Pause the video and select your answer. If you chose option A, you are correct. BMI of 22. While a BMI of 22 may fall within the healthy range for some individuals, it may not be appropriate for all clients. Further evaluation is needed to determine if this BMI is appropriate for the client's age, height, and health status. Question 5. A client is diagnosed with celiac disease. Which food should the nurse instruct the client to avoid? Wheat bread, rice, oats, corn. Pause the video and select your answer. If you chose option A, you are correct. Wheat bread. Clients with celiac disease must avoid gluten containing foods, and wheat bread contains gluten, making it unsuitable for individuals with celiac disease. Question 6. An elderly client is at risk for malnutrition. Which intervention should the nurse prioritize? Encourage a high protein meals only? Provide assistance with meal preparation? Limit fluid intake to increase nutrient absorption? Schedule meals at irregular times to stimulate appetite. Pause the video and select your answer. If you chose option B, you are correct. Provide assistance with meal preparation. Providing assistance with meal preparation helps ensure that the client has access to nutritious meals and can address any barriers they may have to preparing meals independently. Question 7. A client with chronic kidney disease is on a restricted protein diet. Which snack is appropriate for this client? Hard boiled egg, cottage cheese, almonds, turkey sandwich. Pause the video and select your answer. If you chose option C, you were correct. Almonds. Almonds are a low protein snack option suitable for clients on a restricted protein diet, such as those with chronic kidney disease. Question 8. A client undergoing chemotherapy reports nausea and difficulty eating. Which meal option is best for this client? Spicy chicken curry with rice, grilled cheese sandwich with tomato soup, fried fish and chips with coleslaw, creamy mushroom risotto with garlic bread. Pause the video and select your answer. If you chose option D, you are correct. Creamy mushroom risotto with garlic bread. Creamy mushroom risotto is a bland, easily digestible option that may be more tolerable for a client experiencing nausea and difficulty eating due to chemotherapy. Question 9. A nurse is teaching a group of adolescents about healthy eating habits. Which nutrient should the nurse emphasize as essential for growth and development? Vitamin C, iron, vitamin D, vitamin K. Pause the video and select your answer. If you chose option B, you are correct. Iron. Iron is essential for growth and development, particularly during adolescence, as it is necessary for the formation of hemoglobin and red blood cells and for oxygen transport throughout the body. Question 10. A client is diagnosed with lactose intolerance. Which dairy product is best tolerated by individuals with this condition? Milk, yogurt, cheese, ice cream. Pause the video and select your answer. If you chose option B, you are correct. Yogurt. Yogurt contains beneficial bacteria that help digest lactose, making it better tolerated by individuals with lactose intolerance compared to other dairy products. Click that subscribe button and join us next Friday.